Director of the CDC, Dr. Rochelle Walensky, today got very stark and warned the country about her fears of impending doom. As new COVID cases, hospitalizations, and deaths all start to rise again for the fourth time in this country. Dr. Walensky is a scientist. She is not prone to hyperbole. She sticks to the facts and the data. When she talks about having a sense of impending doom, that seems like something we ought to listen to. Joining us now for the interview is Dr. Rochelle Walensky, Director of the CDC. Director Walensky, thank you so much for making time. I know it's been a long day already.
Thanks so much for having me, Rachel. Good evening.
So we are at a time, in some ways, of at least measured optimism in this country, vaccinating a record number of people every day, and the pace seems to be, if anything, improving. And yet you issued this sort of dire outlook for how things could go if we're not careful. What is the doom that you sense might be impending?
First of all, I just want to note that I share this optimism. I'm so impressed with our ability to vaccinate at a clip of 3 million vaccinations a day. We have 93 million Americans who have gotten their first dose, 51 million who have gotten their second dose, and we can kind of almost see the end. We're vaccinating so very fast. Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data. And yet, on the other side, I'm watching the cases tick up. I'm watching us have increased numbers of hypertransmissible variants. I'm watching our travel numbers tick up. And the sense is I've seen what it looks like to anticipate the oncoming surge. And what I really would hate to have happen is to have another oncoming surge just as we're reaching towards getting so many more people vaccinated. We're still losing people at 1,000 deaths a day. And so I just can't face another surge when there's so much optimism right at our fingertips.
Is it possible that the pace of vaccinations already is such that the rising numbers of new cases that we're seeing will not be followed with the same level of surge in hospitalizations and then following that deaths? Is it possible that there are enough high-risk people in the country who are vaccinated that even terrible amounts of transmission are not going to have the same consequence in terms of people ending up in the ER and in intensive care?
That's a really good question, and one we're looking at. It could very well be, given that we have, been vaccinating our people over the age of 65. Those are the people that have accounted for 80% of the deaths so far, that we've done so well in vaccinating the, more senior members of our society that deaths might not be what we would have expected with prior surges. It's also the case, though, that, if we don't see those number of deaths, the deaths that we're going to see is among younger people. Obviously, we don't want to see those either. And there are plenty of reasons to not want to have COVID outside of just the deaths alone. We know that about 10% of the population that gets sick with COVID has long haul syndrome, has symptoms beyond 3 weeks, cardiac challenges, depression and mental health challenges, pulmonary challenges, renal failure, clotting. So there's a lot that we don't understand about this disease, and we shouldn't want to have it circulating whether or not it leads to mortality.
When you talked about the risk that you're also worried about in terms of sort of hyper-infectious variants, hyper-contagious mutations of the virus, is there a sort of a nightmare breakthrough scenario in which we can't vaccinate our way to an end of the epidemic, specifically because the variants are evolving in such a way that they develop resistance, and we have enough circulating resistant virus that we can't get ahead of it?
Certainly that's possible. I don't think that's where we are right now. We do know that this hypertransmissible variant that we're most worried about, the B117 that originated in the UK, is now about 26% of all circulating virus around the United States right now. Some regions in the southeast are up to 36% of circulating virus, and about 5 of the HHS regions now, the B117 variant is the most predominant variant of all circulating virus. So that is concerning. What we do know is that so far it appears that the B117 is neutralized by our current vaccines, but that is among our concerns, that if you have enough virus circulating, those variants can mutate even more and lead to sort of more troublesome variants in the future, which is why we just really want to stop the circulation of virus.
Right. It's why the vaccination pace needs to be as fast as possible, and why we need to reduce transmission while we are simultaneously vaccinating people. Dr. Walensky, there's one other piece of that, the transmission reduction part of it, and that plea from you and that follow-up plea today from President Biden that I'd like to ask you about, if you wouldn't mind sticking with us for one more segment.
Of course.
Dr. Rochelle Walensky, Director of the CDC, is our guest. We'll be right back. Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.